Okay, so on to the history. Many of the pointers here have actually been taken from students in addition to examiners, and this is probably the section, or one of the sections, in which there's been quite a bit of input from the students as well. And the reason for this is because the students are the ones who experience the limitations of time when they're actually in there taking the history. So many of the points I'm going to give will relate to getting enough information from the history in the limited time that you have. Now, the first point that I should remind everyone of here is something that the BMA Medical Student Committee pointed out, in that professionalism, or one of the most important aspects of professionalism, is assessing the introduction and gaining permission. Now, this is something we don't really need the BMA to be telling us about. It should be quite ingrained within us right now, that when we go to speak to a patient, we first introduce ourselves and then we gain permission. And really, these are two very simple but easy aspects of assessment that we should be picking up. Now, the ISCE packs mentioned that in order to get a satisfactory assessment of the history, one needs to take all the relevant details pertaining to that person's presentation, but for it also to be focused and efficient. Now, one examiner elaborated upon this, and he mentioned that when we go through a history, we should already be thinking about a differential diagnosis. Now, this may sound quite obvious, but just to remind everyone that we should be thinking about a differential diagnosis whilst we're taking the history, and we should use a history in order to differentiate between all the different options and actually focus down and exclude some things that may not eventually come onto the differential list. We don't want to leave this until the 5-minute timeout at the end, where we start then to put everything into a list, because 5 minutes is really not that long, and if we leave all of that till the end, then we're not really going to be able to organize thoughts concerning investigations and a management plan. Also, along the same lines, some students say that it would be an idea to organize notes also as you're going along, and I think this is one thing that many of us are so used to doing, where, for example, we're in hospital, we're on the wards, and one of the F1s, or one of the house officers asks us to go and take a history from someone and clerk them for the first time, and then we go and scribble everything onto a piece of paper, and then when it's time to go and put those in the notes, we quickly write them up in a neat and organized manner. But actually, all we need to do, and one practical tip here, is that when we're in the ISCEs taking the history, even if we make physical boundaries, so we make one box for history of presenting complaint, one for the drug history, one for social history, past medical history, and so on, so that when the patients give you all the information in a disjointed fashion, you can go straight into that box and start filling in something there, and then go back to the first box and put something in there. That way you don't have to sit down in the 5 minutes and start to organize them a second time round. So in summary, organize your thoughts and organize your notes as you go along, and don't leave it till the 5 minutes at the end, because those 5 minutes are going to be really, really crucial in formulating a management plan, as I mentioned. And also just a reminder that when you take a history and you take all the information, or you ask all the questions pertaining to symptoms of the system, don't forget associated symptoms as well. So for example, whichever system you're going to be taking a history on, if you have to consider malignancy, then think about associated systemic signs or systemic symptoms. For example, weight loss, night sweats. If we don't sit down and think about these things beforehand, then we're just going to go into the station and automatically ask all the questions pertaining to that system in particular, and we'll forget about all those associated symptoms, which are so crucial in actually prioritizing the differentials relative to one another. Another common problem is the chatty patient. We've all been there. Sometimes patients are generally pretty pleasant to talk to, or in some cases just listen to. However, the exam situation doesn't really make it very conducive, or doesn't really make this situation very conducive to time management. So really, we need a way to get out of this. And this may particularly be the case in, for example, psychiatry, where you may have a patient with mania who is very, very difficult to actually interrupt and get in a word in edgeways. So one of the tips that some of the students mentioned that they actually did on the day was to explain to the patient beforehand, and in some cases even apologize to the patient beforehand for the fact that they may need to interrupt them because of the fact that they have such a limited amount of time. And many students have actually said that this has avoided awkward situations afterwards, and obviously it can seem to some to be a bit rude to actually interrupt. It's not something that we normally try to do if we have the time. A final note is that we need to be practicing the history just as we practice the examination. So what this means is that we need to get two of our peers, get one of them to come up with a plausible case and act as a patient, and get the second person to assess us. And we need to be doing this in real time, so in 10 minutes. And we need to have the ISCE packs in front of us so that we know all the different criteria and what we actually need to do to pass. And the assessor, our other peer, needs to be quite tough on us and actually pick out points that we could improve upon. Because many of the students, they found that they were practicing for the histories, not practicing for the examinations, or rather practicing for the examinations, not practicing for the histories as much. And as a result, finding it more difficult on the day. So, in summary, just to round off everything we've covered in this section of the history, first of all, organise your notes as you're going along. Secondly, organise your thoughts as you go along. Focus your questions according to the differentials. Also, know all of the symptoms of a given disease or a given system inside out. And on top of that, know all the associated symptoms that go along with all the main diseases of that system. Also, communicate clearly to the patient about interruptions before it can become awkward or appear rude. And finally, practice plenty.